Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Dr. Damaris G, Integrative Family Nurse Practitioner, and welcome to the Mindfully Integrative Podcast. So today I'm actually just doing a discussion about my birth story and being a new mom this past year. And the reason I'm talking about my birth story is that it was not what I had planned. And I am one where I plan things. I'm a planner. I get things all allocated. And I also was one where I wanted to have a birth plan for my midwife and my OB. And I also was one where I knew if I had a concept of what my needs were, I would have everything perfect, right? Not necessarily perfect, but it would go in the plan that I had expected. And unfortunately, it did not. I will have in the show notes, my planning that I did do, that I had a maternity list, I had a hospital bag, I had special doctors that I planned to have, like a high-risk doctor. I went to a quality facility and hospital that could take care of me and my little one as needed. But I really thought that I was going to have mostly a natural birth. I was going to have a vaginal birth. I was even bringing yoga ball and massage and my music. And I had the intention of holding my little one as soon as possible before holding the cord. And I would have to say, let's go back to my pregnancy. So I am a multiracial woman. I am Spanish, Black, and of different other ethnicities. And I am one where, as a minority woman, we are, unfortunately, our genetics will predispose us to probabilities of increased health issues in pregnancy. I really thought as an individual that was so-called healthy, did not have to worry about what my health was because I would walk every day, I would exercise, I ate pretty well from my understanding, but I was predisposed genetically, and also stress had been a factor in my pregnancy. So for me, I was overcautious during the pregnancy, and I would take my blood pressure once a day. Usually I'm very low. I'm like 110 over 70 is like in a really nice quality range. As I went through the pregnancy, I was gaining weight a little bit more than I had wanted. I really did not eat anything excessive. I'm not really a big craver. I may have had a couple cravings in the second trimester. My husband liked cereal and I'm really not into cereal. So I had some sugary cereals and then I stopped that. But my overall food intake was not very large, but I had been gaining weight. My blood pressures were increasing little by little, not like severely initially. It was like 110 and the next week it would be like 112 and it'd go up 2 ticks and then it started to go into the 120 range, still no big thing. And you'd be like, okay, that's not a problem. The doctor was like, you don't have to take your blood pressure right now. Everything with the baby's going well. But I guess as a healthcare provider, I thought, you know what? Let me just do that for myself. And for some reason, thankfully I did because it saved my life and it saved my baby's life. So through the time, as you know, that was when it was COVID and the pandemic hit in my third trimester. So I was transitioning out of the clinic and going a telehealth position so that I put myself in less risk of contracting the COVID virus. During this time, my OB was stating to me that if you do contract the virus pregnant in your third trimester, I'd like you to sign an advance directive because we'll probably have to put you on a ventilator and your baby or you may not survive. So please notify your next of kin, which was my husband, and family that we have to prepare just for every outcome. So I was surprised because my plan and my thoughts and things that I wanted were not going to probably happen, but I wasn't sure initially. I thought at least I was going to this high-risk doctor. I had a midwife and I should be able to have that vaginal birth, get all those antibiotics for my baby, and I will be able to, I'm a good, healthy individual and we'll get through this. So the reason I even go into this story more is I know that there's a woman, a minority woman on this podcast or on this listening that may not realize why you are in this category of a risk. And what happens is that the OB, not any offense to him, but he didn't check my blood pressures regularly or on point. I did, and I was kind of letting him know that they were starting to creep up and things were changing. I said, I don't feel like myself. And he says to me, oh, well, maybe you need to lose a little bit of weight. Well, throughout the pregnancy, toward the end, I got up to about 210 pounds, and I'm not tiny, I'm like middle-sized person. I'm usually around 140 range to 150. Sometimes it fluctuates up and down 10 pounds. But for the most part, I gained like 60 pounds in this pregnancy. And that's like a ridiculous amount of weight for me. One, tired all the time. I started to have the precursors of what ended up being a preeclampsia episode, but it ended up being very severe and HELP syndrome. I, as a healthcare professional, thought, well, I'm taking my blood pressure, I'm walking, I'm eating okay, I have a good doctor, I should be able to have everything that is needed. And the reason I want people to understand birth stories are not always the way you think they can be, but there is possibilities of having the love and the best outcome as much as you can. So I planned the list of everything that I needed. I planned how I wanted to get delivered, which is vaginally, minimal medications, epidural as needed. I was willing to go to the right doctors, go to the right NICU if needed. I almost was going to have a water birth, but I was older. You know, I'm 39 when I had the baby. I'm 40 now. And realized that, you know, it may not be my cards to have a water birth. So I said, all right, I'll have it, you know, at the hospital, but, you know, still thinking I could get through. Unfortunately, my little guy was born early. And before that, a few weeks prior, what happened to me was I was in this preeclampsia state. And preeclampsia means blood pressure increases over time. And sometimes it could be early, and sometimes it could be during the pregnancy or after the pregnancy. The thing is I never had blood pressure issues, major health issues, but it's a complication of high blood pressure, and it can damage and put your body into organ failure, kidney failure, and then detriment to you and your child. This usually happens after 20 weeks. I didn't realize how severe it was, but I was very grateful I had been checking my blood pressures regularly. And I just did that just because I'm a little like particular and I'm a healthcare provider. And I thought, oh, well, if I document this stuff, it'll give me an idea. And I actually made a journal. I had an app on my phone, and I had use that to, you know, put it in my phone. So every time I'd go to the doctor, he would know that he'd know my numbers, and I'd say, well, we're doing okay. It's in the 120s. Then it started to get into the 130 range. And I was somebody that, you know, I didn't have that, like I had stated before, and I was starting to gain a little bit more weight, and I was starting to get a little puffier in the face. My hands were getting really like heavy and tight. My legs were getting swollen. And I was like, what in the world is going on? I'm letting them know, you know, where I'm doing checkups, actually, maybe every 2 weeks. This was probably in the 27th week or so that it started to kind of change for me, more tired. And I guess this must have been, and I kind of had an idea. I was like, well, do you think this is I was telling them, do you think I'm having blood pressure issues? So initially they were like, no, we'll check your urine, but honestly, it ended up being the preeclampsia, the word of the blood pressure. And I did go into a toxemia within the body. I am saying and wanting you to be aware because I was familiar with the medical terms. I was familiar with what my symptoms could be. I was familiar of how it could be dangerous. But the scariest part for me, and I know it could be for someone else, is I went each week to the doctor and I was at home. I think I eventually did go on bed rest, or like minimal activity, around the 28th, 29th week. And I noticed, like, for me, even at minimal rest, I would take my blood pressure and I was like in the 150s over such and such. And I would tell the doctor and they would be like, okay, let's just keep an eye on it. Let's keep resting, keep doing your water and, just try to exercise, walk, but not do too much strenuous things. And I was like, and the crazy thing is you don't even feel that bad. You feel a little bit, but you're not, you don't even realize how much it could be affecting you. So the reason I talk about this is because this past week is World Preeclampsia Day. It was May 22nd, and I would have posted this episode sooner, and I do apologize to the listeners that I hadn't, but I want you to know that when you know the signs and you give yourself the tools, you give yourselves the opportunity, it could save your life and then it could help you throughout. So what happens is, this is the other thing that I find very interesting, is that at 20 weeks, most of the time people don't get as many doctor's appointments until about the 27th, 28th week. And I noticed for myself, my blood pressure started to creep up around the 25th, 26th week, and then each week started to change. And it's becomes very misdiagnosed because individuals may think it's something else. And there is a reason why an individual is having a preeclamptic episode and the body is kind of not rejecting, but having trouble. And we as a healthcare provider, I can know some of those signs and I'm talking about them with you. But as an average day person, you don't know. Or you may not know. And I completely sympathize and empathize with you because it's not right to not know, or it's very easy to look over it. So what happened for me was I had an excellent doctor, right? But there were times when the medical assistant didn't take my blood pressure properly. And the reason I knew that is because I would take my blood pressure every morning and then I'd go to the doctor visit maybe middle of the day or earlier, like a few hours later. And she'd be like, I'm 120 over 80 or 110. And I was like, no, I'm not that perfect today. And she would be like, what? How do you know? And I'm like, trust me, mine was 130 over 70 something earlier. I don't think that's correct. So there would be times where, unfortunately, I wasn't trying to be rude to the woman, but I would say, I don't think that's in the right context. I think you might have to take it again. And I try to be, nice about it and realize that, she hadn't done it correctly for that time. And that happens, I'm no fault to her. She's busy or, things are going on and, she may not had realized, but you have to be your biggest advocate. So for the reason I bring it up in minority women is that if you're not your biggest advocate, you, or at least have somebody in your family to help or assist you. I always think that you should have a at-home blood pressure monitor. And then also if you're in that gestational diabetes category, or you have an overweight individual previous to your pregnancy, or you've had a previous history of PCOS, which is polycystic ovary syndrome, then I would definitely put yourself more susceptible to having some complications there's additional things that may come up for high risk individuals like lupus or asthmatic or kidney issues or other things that if you fit in the categories. I'm just talking at this time about preeclampsia. So additional parts of this for me were like the swelling, the water retention, very tired, fatigued. Eventually, toward the end of the pregnancy, I was having blurred vision, headache, nausea, and it became life-threatening for me and for my baby. The hardest part about all of it was that I was a healthcare professional, right? And I thought I could be fine, right? I'm in that category of it's all right. But I'm older. I'm a minority woman. I was not really overweight, but I guess in that range of possibly could be overweight. No kidney issues, no diabetic, no real major health. I did have stress though, and I did have depression previous when I was in the service, and I kind of managed that. So for me, I think my stress levels started to increase, as I was talking about previous, was COVID. So during this month, this third trimester month, I went through the stress of the new COVID situation. I then was a COVID screener for patients, and then my father passed away also from COVID. So I went through a very heightened amount of stress in a short period of time. And I don't think that necessarily means everyone has to be in high stress to have preeclampsia, but I do believe that that was an additional factor. So also consider your stress level as a possibility for this episodes and this condition that could happen to you and your baby. And the reason I know it may seem trivial to think that you're going through just maybe a small blood pressure issue, but it really can be a factor in how you're feeling and what is going on. So the week that the day that I was actually going to have to go to the hospital, I was tired and I had the weight gain and I had the blood pressures that were increasing. But I said to my doctor, it's only 35 weeks. I really want to get another week of the little guy in my belly. You think I could do it? And they were like, nope. My high risk doctor was like, oh no, not at all. He really ended up saving my life, and so did his colleague. Their whole team. I went to this the integrative OB in Mindfully Midwifery, Kristen Mellon, and my doctor is Dr. Abdelikok, and his team were just Dr. Gray. They saved my life. Long story short, but really, what it is that I felt fairly okay. I said, oh, I should be all right, but the issues were my headaches were coming. I had a little bit of a headache. I got super tired. And if I hadn't gone to the hospital that night, the OB had stated we would not have made it. We would have woken up with probably have had a stroke, and I probably would not have survived. And I cannot get over that was a possibility for someone like me, that I didn't think that this is something that I should be worrying about. But I do feel that I wanted to bring more awareness to something as important as preeclampsia and as important as your maternal health and going to the doctor, to your OB when you are pregnant to get the full care that you need. In addition to having the preeclampsia, usually preeclampsia, once you remove the child from the mother's belly, your preeclampsia or this blood pressure and fluid will go away. My issue was I also had the severe preeclampsia with this going into this, they call it HELP syndrome. I think I was on the precursor of that, where your body starts to have bleeding and organ issues. I gratefully was able to come through this. But, I want mothers that are pregnant go through the right maternal health needs and also postpartum needs. So I went to the hospital to get induced, and even then, I still thought I was going to have a vaginal birth. I had such severe blood pressures. They, put me on medications. It's actually magnesium, which I love magnesium. Overall, I think it's an excellent resource for relaxation and blood pressures, but I was on a very high dose to help with this blood pressure issue. So they put you on a drip in an IV. But I had thought once I have this baby, my blood pressures will go away and we're going to be okay. Like, no problem. I'll still listen to some music. I brought my little massager. I was still trying to keep very in tune with myself and really aware of what was going on. Thankfully, I packed my bag. I packed all my things. I just had my husband go get stuff. The negative side on this was we were in the middle of a pandemic. We were in the middle of COVID. So they went to test me for COVID. They thought I had it. And in addition to that, they only allowed one visitor in at a time. So it was just me and my husband were allowed to be in the same room. I thankfully ended up not getting COVID, but there was all of this isolation, had to be by myself, make sure everyone is away from me. And that was scary. My husband and I just having to be in the room by ourselves with no one else, that was, scary and tiring. Then I thought I was going to have a vaginal birth, and not going that way was because my blood pressures ended up getting in the 200/100 range. The induction failed because my cervix would not dilate. My swelling had gotten so severe that my heart was being compromised. And I just was kind of oblivious. So for someone that was the provider, as a patient, I tried to be as supportive to everyone else, and I couldn't even be supportive for myself because I was like, oh, as long as the baby's okay. And, so it's just kind of realizing the minority racial disparities that can even happen for someone, even of my knowledge based and things. And it's I want people to know that, to not, take your blood pressure and a symptom of this lightly, and really be your best advocate as possible. So I was able to go for an emergency C-section late in the, early morning. I think he was delivered around 3 a.m. My little guy had to be intubated on a respirator. So it was a little stressful, but he ended up doing wonderful. And I ended up doing wonderful in the long run. It was a long recovery. He only was dealing with about a week and a half in the NICU, and I was about a week and a half in the hospital. We left at the same time. During that time, I was on blood pressure medications. And in addition to the preeclampsia, I also had post-preeclampsia, meaning that after the little boy was delivered, I then had to deal with high blood pressures post pregnancy. And that's hard because I had thought this was going to go away. And this is another part where postpartum care is just as much as important. Now, I have a knowledge base as a healthcare provider of my medications. I have a knowledge base of my blood pressure, of what symptoms to look for. But on average, most people don't. And also on average, people don't have the support they need and the postpartum care that they need. No offense to my OB, but there really is no care from after the baby is born for the next 3 months of time. I believe that there is such a lack in the healthcare community, and especially for minority women, Black, Spanish, and the lower income population, there is such a lack and disconnect from the care of when a baby is born. And then I'm saying those first 3 months, that fourth trimester especially, that's where there's a lot of postpartum depression. There's a lot of postpartum issues. And there just really is not enough information for moms. And I don't feel like it's the pediatrician's responsibility to do all of that. And I think that's where there's this disconnect. And I almost feel like there needs to be, I don't know if it's an OB, connection with the maternal. I know that they're getting better with it because there's more technology out there and there's this like mommy app and stuff. But if anything, I definitely will be an advocate for those women trying to figure out that fourth trimester and advocating or trying to really gain some support, because I don't think there is enough there. Even though people say that there is or there isn't. I think addition to the postpartum depression that people go through, like I had to be on a lot of medication. Then I also had some cesarean section healing. I had to go for an additional abdominal surgery because I had severe scarring and endometriosis that I was dealing with additional to that. So for me, it was a very traumatic time, and I did have good support from my husband and family, but I was scared. And if I'm scared, I can only imagine those that are listening and those other moms out there, what they need. I will put in some resources of different individuals that are like the Mommy app and a couple other available resources for moms and those that may be pregnant now. But, I felt that I needed to discuss this, being that it was World Preeclampsia Day the other day. I wanted to discuss that I'm grateful for a healthy baby boy. I am grateful for my life that I almost lost and didn't realize, or a stroke I might have had. I had already had severe traumatic brain injury when I was in the service from an injury, and injured my neck and back. And I'd already been in that road of recovery, and I can't imagine having to do that again. Or would I even still be able to be a provider or help my baby? So when I think about it now, I'm so grateful that we've come this far, that not all of it is perfect, but I do the best I can. And I want those that are on, to know that you have the opportunity, and to just let yourself know that it's okay to be upset sometimes. It's okay to be the best mom that you want to try to be, but you do what you can. Ask for help, and know the signs of different things that are going on with you, so that you have the additional support and the needs. And asking for help is okay, and not feeling 100% or always feeling like you're the you don't have all the answers is okay. Especially with like breastfeeding and what to feed your baby and your hormone changes, and things like that. So those are factors. And then additional things, you would ask a pediatrician to help with your child too. So I'm, that advocate, and just kind of wanted to say that I'm very grateful for the life that God has given me, and the life that I have for my healthy boy. So it's a miracle. And now I even more so feel that each day is a miracle. So those listening, thank you. And I hope that you find a mindful way each and every day, and that you find some peace even in the darkness. You have a wonderful day and night, whatever it is for you. Namaste and good night.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only, and is not to substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.